Today we will be looking at the history of healthcare in the United States. We will look at the system, how it came to be the way it is, why it is so complicated, and how it got to be so expensive. Prior to the 1800s, the country did not look like it does today. There were large, vast territories that had not been explored, and so the government asked frontiersmen to go out and start exploring and settling the new land. In most situations, when someone was sick in the family, mom was the primary caregiver. She took care of most illnesses and only summoned the doctor in an emergency. This doctor worked for money or fee-for-service, but since money was scarce, we often bartered for the doctor's services, trading things like cattle and eggs. Doctors were not consistently trained at that time and were often very spread out, which resulted in the outbreak of many epidemics. The government took on the responsibility of establishing public medicine to help avoid and treat these epidemics. After the Civil War, we started to see an organization of the healthcare system that resembles a lot of what we have today. Hospitals started cropping up across the nation in order to care for our Civil War soldiers who were wounded. Nurses were recruited to assist in their long-term care, and medical schools started cropping up across the country, which allowed for doctors to be more consistently trained and demand higher pay. This higher pay for physicians, nurses, and the need to cover costs at hospitals led to a dramatic increase of costs across the country. And then came the Industrial Revolution. Factories and businesses everywhere would do whatever they could to keep their employees healthy and working. This included taking care of them when they were sick or injured. This is the establishment of the very first private health insurance. Of course, this health insurance was available only to employees of the business and only covered them in case of a catastrophic injury or emergency. At the same time, physicians got together and created the American Medical Association. This is a national organization that created standards for physician practices, which ultimately also increased cost of healthcare. 1940s and World War II would bring major changes to our healthcare system again. Industry finally recovered from the Great Depression and was off to a booming start. Many of our men were off at war, fighting battle overseas, so there was no one here to stay home and fill the jobs that were available stateside. The government got involved and quickly put in regulations that said that industry could not compete for business by paying their employees more. We call those wage controls. Instead, they allowed industry to create benefits package for their employees in order to attract more people to come and work for them. This is how the system established employer-sponsored health insurance, which would be the norm for the next 75 years. When the war was over and the boys came home, there was a baby boom. More children were born in the next 10 years than at any point in our American history. One doctor would not be enough to take care of all these children. And so, there was an establishment of the whole healthcare team. Additional personnel were brought in to do x-rays, nursing care, blood draws, administrative skills, etc. In the 1960s came another major change in our healthcare system. A social awakening was about to take place. Social programs such as Medicare and Medicaid were established to take care of those individuals who did not have an employer in order to sponsor their health care coverage. Medicare came with two plans, Part A and Part B, in order to assist the elderly with their health care costs. The success of this social program gave way to additional public health programs such as Medicaid and the Indian Health Service. Then came the 1980s, a time of big hair and big dollars for physicians across the country. Doctors had multiple streams of revenue coming in from both public and private health insurance dollars, and this allowed costs to get out of control. In response to these skyrocketing costs, health insurers approached the government with a brand new way to give health care. HMOs, health maintenance organizations, were born. This model allowed health insurers to get away from the fee-for-service model that used to exist and allowed health insurers to negotiate deals and costs for services before the patients even step in the door. Physicians viewed this model as an attack on their bottom line, so in response, they started outsourcing services such as blood draws and x-rays. This change gave rise to ancillary health facilities such as private labs and surgical centers. The 1990s brought a digital revolution where the advent of the internet allowed medical information to get directly into patients' hands. Now, when patients had a question about their health or the health of a family member, all they had to do was go online. This allowed patients to educate themselves and become more prepared and engaged in their personal health care. Direct-to-consumer marketing has also played a major role in the continual rise of healthcare costs. Patients now see a medication on television, go to their physician, and ask them for a prescription. That brings us to present day. While many things have changed over our history as a healthcare system, many things are remaining the same. Rising costs continue to be a concern, and how will we get care in the future? In 2010, Congress passed the Affordable Care Act, which requires that all U.S. citizens carry some form of health insurance and set up medical health insurance exchanges for individuals without an employer-sponsored program. While many of these plans are intended to cover basic services, many of them have extremely high premiums and deductibles, which results in a patient having higher out-of-pocket expense. In the meantime, many physicians and patients are looking for a way out of this system altogether and creating concierge medical practices where physicians take on a small number of patients in exchange for a monthly retainer or fee. Customer service is key as the physician-patient relationship is restored to its most basic level. And that's the amazing thing. No matter how complicated our system seems to get, no matter how much we continue to grow and change, there are certain parts of it that will never change. The family unit and the physician are integral parts of our United States healthcare system. As long as we have that, we're going to be just fine.